really the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Well, hi, we're back again. This is Dr. Natalie Keith.
And I'm Dr. Tracy Trussell.
I know, which is really exciting because, so Dr. Trussell and I have been business partners for 13 years and just started Vet Tales not too long ago. But this is your first episode because I'm kind of the talker.
That is correct.
As it were. But yeah, so I got you to come sit down with me because a couple of things. One, the Facebook Live people were like, do you think Tracy will ever do one? And I was like, maybe. So I'm going to try to pull up the lives for them because I kind of forgot to do that earlier. But the people love watching you. And so we're going to do that. And then also I brought you today specifically because I wanted to talk about masses or growths.
All right.
Are there any other words?
Masses, growths, lumps, tumors.
Oh, yeah, tumors. They used to call them tumors a lot.
Yeah.
Bumps.
Yeah.
Knots.
Back when I got out of vet school, way back in the Stone Ages, a lot of them, the surgeries were just called lumpectomies.
Yes.
Which is a little crazy, I thought.
Yeah. It's picking. There you go. So anyway, why do you think I wanted you to come talk about masses?
Because I'm the one that takes most of them off.
That's exactly why. He's the lumpectomist.
Yeah, I'm the one that takes 95% of them off, probably.
Yes, the surgeon of the crew. I mean, granted, we all can do mass removals, but that's kind of your wheelhouse, is staying in the surgery room, doing
Right.
the surgery things. And so so I thought, well, who better to talk to about masses, because you've seen them inside out,
Seen
all
them
through the
everywhere.
all the kinds.
All the kinds.
Yeah, because I mean, granted, this is our 13th year working together, but you've been at this how long now?
19 years.
Which is weird since you're only 24, right?
Right.
Yeah. Anyway, so yes, some experience. You see a lot of stuff in 19 years.
Yes.
So I was hoping that maybe you could just tell people, what is a mass or a lump or a tumor or a growth or a what?
Oh, it's basically any group of cells that is abnormal in where they are. Like for instance, I did one today, did a lipoma, which is a fatty tumor. Mm-hmm. All bodies have fat in there, but these fat cells have conglomerated and they're just not doing exactly what they're supposed to do. Mm-hmm. So you can see it on the skin on a lot of them that we see. They're external. You can see them on the skin. You can see a deviation in the skin.
Feel them, touch them.
Feel them, touch them, move them around. Some of them, but it's just some cells that are, most of them naturally occurring in the body. They just are acting weird.
Yeah. And I think if I had a dime for every time I explained a lipoma as an abnormal congregation of fat cells,
Yes.
I could, probably have a nice dinner at least.
Yes, at least a nice dinner.
Yeah. So, okay. So why do you think people are bringing us these lumps and bumps?
To find out what they are.
Right.
And probably even deeper than that, to find out what the results are. What are those lumps and bumps? What is this lump and bump going to do to our pet?
Mm-hmm. Yeah. So, walk us through what that looks like. What is the process of getting that answer?
Well, there's a couple of different ways we can get that answer. And part of it depends on what we feel like it may be.
Yeah, because you kind of have an inclination of what you think the growth is going to consist of.
Right, you got a pretty good idea. I mean, just from experience, and that's where it comes from. Just knowing kind of what growths are in what areas of the body, what they look like, what they feel like. We do some fine needle aspirates where we just take a needle, put inside the mass, get a few cells out, look at them on a slide. can get an idea there. Some of the masses that we're a little more concerned with about metastasis, where they go elsewhere in the body
Yeah,
than just
spreading
where they
to
are,
other
from spreading
organs.
to everywhere.
Anywhere.
A lot of times I don't opt for the fine needle aspirate because I don't want that tract. If we can't get to surgery for a week, or say I don't want that tract. If I did go all the way through with the needle, I don't want to introduce those tumor cells somewhere that they're not.
Right, because certain cancers can
Right.
take advantage of those tracts.
Yes. Yeah, there was...
Especially like transitional cell carcinomas in the bladder.
Yes.
Which we haven't even talked about the lumps and bumps you can't see. Those are the scary ones, to be honest.
Those are the really scary ones.
Yeah, I think owners come in, like, worried about the lumps they see, and we are worried about the lumps that nobody sees.
Right. Yeah, it's just a quick side note. And because they can act really weird. When I was actually still in vet school a long time ago, I was on preceptor, and we had a cat that was about 15 months prior to me getting there. They had diagnosed with an oral squamous cell carcinoma, a little bitty lump on the tongue. And said at the time it wasn't much more than the size of a pinhead. And took it off, cat's doing fine. Comes back a year later, and it's there about the size of a BB. They take it off. And then about 3 months later, which is when I'm there, on a Thursday afternoon, we take it off. It's a little bigger than an English pea, nothing crazy.
Are English peas bigger or smaller than a traditional pea?
Well, I just call them English peas. I think they're probably traditional peas.
Okay, I'm just
But
curious. I've just never heard English pea before, so I was trying to
the
picture
little
it.
green round ones?
Yeah, like like a pea, like a can of peas.
Yeah, those are English peas.
Okay.
Yeah, same thing.
Okay, I just want to make sure.
Yeah. We took that off, probably went to surgery about 3 o'clock that afternoon, Thursday afternoon. That following Saturday morning.
I don't like where this story's going.
No. The cat shows back up, 8 o'clock in the morning. There was nothing but tumor in its mouth.
Just blew
up.
Yeah. Yeah, I mean, because, I think just going back to the original description of what it is a mass, and this is abnormal congregation of cells, but also those cells behave abnormally and they start to mutate. And so then they can do really wild and crazy things, and they don't behave like a normal cell.
No.
I remember I took a pathology, summer internship or whatever you want to call it. Like I worked in the pathology lab over the summer of my second into third year of vet school. And I remember them looking at these samples of these tumors and then being like, we think it used to be this. But it was so morphed and changed that they really weren't even 100% sure what it used to be when it was a normal healthy cell.
Yeah, the cellular structure does not...
Yeah. They could kind of lump it into a broad category, let's say.
But it doesn't look like a normal, or remnants of a normal liver cell or spleen cell or kidney
Yeah,
cell.
you're just it used to be like a squamous cell. That's as close as I can get you. And so those aggressive ones like that, those are terrifying.
They are.
They do not play by the rules.
They are. And on a lot of those that we suspect would be aggressive, the other way that we'll diagnose them, and the one to get ideally the best possible diagnosis, most accurate diagnosis, is we take them off and then send them to the histopathologist, the people that look through the microscopes all day, every day at these.
So tell them why that's better than a cytology.
The histopathologist will actually take the complete mass, the complete lump that we send, and I don't know what all kind of fancy magic they do to it, but they fix it and then they start slicing the whole thing up and put little slices of the whole thing on the slide to be able to look at it. Whereas if we're doing the fine needle aspirate, we've got a little tract, usually 20 to 22 gauge needle we go in with. So it's a very small core sample that we're getting, hopefully.
And then you're blowing them out haphazardly onto a slide.
Right. So, I mean, you can cause some damage to the cells in that way as they're getting on the slide, as they're coming back through the needle. You can cause some damage to them going in with the needle.
Yeah.
So if they have a complete mass to be able to fix and slice and lay complete full thin slices, 1 or 2 cell layers thick on the slide, they have a bigger population to look at, so you can get...
It's about the architecture too.
Right.
I always think about it like this may hit a little too close to home for us. But I think about it like this. If you have a cross section of a building, you have a much better idea of what that building is than if you have like post-tornado debris, where you have
Right.
like a doorknob and like maybe a piece of an x-ray machine and like, you know, something like a microscope. You're like, oh, I bet this was at like a medical place. You know, it's just much harder to see the full picture.
Yeah.
So
Yeah, it is. I've got that in my pasture right now.
yes.
If you
yeah,
didn't
literally
know, if you
too close
didn't
to
know
home. Yeah.
that used to be a calf shed,
You might not know it.
it's just some kind of building.
It's just a chunk of wood and tin.
Yeah.
Yeah, so poor Dr. Trussell, we lost our building in April to a tornado, so we're sitting in a trailer that we're renting via insurance right
Right.
now. And then, which is why the air conditioner is so loud in the background, in case anybody hears
Yes.
that buzzing, is like, what is that noise? It's the air conditioner. And then, like, literally 4 months, 5 months later, 4.5 months, Dr. Trussell loses his barn and shed and back porch to
Yes.
a downburst,
Yep.
which I just learned about myself, which is not our podcast topic, so...
No.
Anyway, but yes, tornado debris is the same thing as a aspirate cytology. You're going to find some damaged remnants of what used to be inside of that building, if you will.
All right. But then the histopathologist can take you through with the video camera, and you can see that
A
building.
tour.
And you give it a little tour.
A little tour. A little tour of that tumor.
So
Okay.
that's why it is better, and that's why on some of those that I consider that I think have the potential to be aggressive, one of the big ones is the anal gland masses. I don't know that I've ever done a fine needle aspirate on one of those, and I don't think I ever will. Just because most of those are adenocarcinomas, they're bad,
And they love to go places.
and you get them out of that anal gland, they will go everywhere.
Yes.
So we just go in and take them out.
Yeah.
Take the whole anal gland out.
Yeah.
My probably second least favorite surgery. I'm pretty sure there's another one that's more of my least favorite, but I'm not sure which one.
Maybe a PU.
Possibly.
Yeah.
But yeah, so some of those more that may have the ability to be more aggressive historically, you know, of what we found in there. I won't do the fine needle aspirate because I don't want to take the risk of what it can do, knowing
Yeah.
what it can do on the backside, and just do a full mass removal, take the margins that I think are going to get what we need to get a full tumor, and then send them off.
And then, like, so what's the point of that then? So they give you this answer of what it is. What do you do? Because a lot of people are like, why? Like, it's gone now. I'm not going to do chemo. I hear that, like, 3 times a week.
Well, is it gone?
Yeah. One.
That's the question.
Where would it go if it's not? Like so you take off a skin tumor that's bleeding, let's say, and it comes back with an hemangiosarcoma diagnosis. What are you going to do?
Well, we've got a couple of options. One, we're going to watch that site really closely. We're going to look at the reports.
Recurrence concerns, like, is it going to come back there?
Right. We're going to look at the report, see kind of what stage it was, how aggressive they think it's going to be. Those reports are not always 100%, and the guys that are reading it will tell you that. If they won't tell you that, they're lying.
They have
honestly.
overinflated their, what is it they say? Seldom wrong. No, wait. It's oh, wait. Hold on. It's going to come to me. How does it go?
How does
Often
it-
wrong. Never in doubt.
That's right.
That's it.
That's right. But I mean, because they're human too. So.
And they're working with a limited amount of information still.
Right. I mean,
and Mother Nature.
Yeah. They have the history that we give them, the tissue that we give them. They haven't seen the patient. They haven't seen the full history. You know, they have been seeing this patient 3 times a year for the last 9 years. They don't have that information that we have.
Yeah.
So, and sometimes we'll call and help them with that, you know, if there's a question in there. But they can be wrong on times, and sometimes
To no fault of their own.
Yeah, to no fault of their own. They're doing what it appears. I mean, it's their opinion is what it is that we're getting.
Yeah, that was the main epiphany I had that summer. Was I would like there'd be a tough case, and you would see the pathologist like walk down the hall to every office. What do you think about that? What do you think about this one? And I was like, oh my gosh, y'all! I thought this was fact. It's not.
No, it's their opinion.
Yes.
And several times they will go get 5 or 6
But
opinions.
educated
right.
opinion.
Get 5 or 6 opinions.
The
and
more
if-
opinions you have, the less sure they are of their diagnosis.
Yeah, you know, if you have go ask 5 and you have 4 of them say the one thing, there's a pretty good chance that you're there. But if you go ask 6 and you get 3 of them, you get two saying one thing. You get 3 different answers
with 2 each.
With 2 each, yeah.
If you have 6 different answers, just go home for the day and try again tomorrow.
Yeah, it's not going to be there.
Yeah.
But anyway, so we look at the report for that, just kind of see what it is, what their opinion is, what it looks like. And then one thing I really look at is the margins, because certain types of masses, you need certain length of margins from into what they call clean tissue, where you don't have any cells,
abnormal cells remaining,
to classify it as gone.
Yeah.
Or completely excised, I think is the wording they used on there, but basically where it's gone. But even at that point, if it's one of the aggressive tumors, the hemangiosarcomas, mast cell tumors are big for this. It may be gone completely there, but that doesn't mean 1 or 2 of those cells didn't sneak out before we got it removed, and they're fixing to be popping back up.
Yep.
And another thing we do look for, if we have room, is if we didn't get full margins, we know exactly where we were. We can go back in and take bigger and deeper margins.
Yep.
To a point. If you have something on the rib cage, there's only so deep you can go. We don't want to be cutting ribs out.
No, and nor do we want to perforate the thoracic cavity.
Right.
X-nay on that.
Yeah.
Do not recommend.
So you have some limitations. I mean, it can be done.
Yeah.
There's some specialists that will do that. I will not.
Mm-hmm. Yeah, you need like ventilators and stuff.
Yeah, you got to have ventilators and a little more experience than I have.
You have plenty of experience, but just not with that particular.
Not for that particular.
We
thing.
avoid them.
Yes.
And luckily, it's rare.
It is rare. It is rare. I've had several trying to go down. I'd have to scrape all the way on the leg, scrape all the way down to the bone.
Am I the only one cringing when he said that? Just
no, because I cringe a little bit too every time I do it. And still wasn't deep enough.
There, what are you going to do? You can't go anywhere else. So.
No, you can't go any deeper. So, but if we have room and enough tissue there and the ability, we can go back in and take some bigger margins if we need to. But then it also, they grade it, tell us how aggressive they think it's going to be. And some of them, they'll give us kind of life expectancies.
Like typically when we see this type of tumor with this grade, the statistics on the lifespan post-diagnosis is XYZ.
Right, and they may get one that say, without any treatment, we've got 6 months. With full chemo treatment, they're seeing 18 months. And that's on average, which means that not all of them make it there, and some of them make it longer.
Yeah.
And then we've got to weigh that. Is it worth the further treatment or not?
And back to the hemangiosarcoma, for example. As soon as I get that diagnosis, now granted you're a surgeon, but I'm internal medicine, so the first thing I'm thinking is spleen.
Mm-hmm.
Is it on the spleen already? If it is, I need that spleen out before it's in the liver too. And so we're doing we'll do a lot of times when we check these tumor dogs in, they're coming in for a mass removal, we will do a what we call a MET check. And so we'll do imaging, so x-rays of the chest and abdominal ultrasound to see is it inside as well, because when this dog is out, we need to be removing the spleen. If it's in the spleen, that's just I'm going to start recommending splenectomies on spays.
That's probably not as bad.
Just save me the trouble when the dog's 9.
Right.
Please. Hate the spleen and all of its tumors. Everything ends up in the spleen or the lungs.
And the problem with
they need the lungs.
The problem with the spleen is they don't show any signs or symptoms of it until they're almost done.
Yeah. So when
almost gone.
Yeah, when you have your veterinarian going we should do some screening, and you're like, my dog's fine, and we're like, yeah, but I'd like to find this before your dog's not fine, because then we're in a whole different pickle. It's already metastasized and spread to other organs and da-da-da-da-da.
Right.
And it's so common, so common. We do multiple splenectomies for tumors a month. Yep. Depending on the month.
Yeah, depending. I mean, we probably average, honestly, probably 20 a year.
Yeah, that feels fair.
You'll
have 4 in a week, and then you might have a dry period for 6 weeks where everybody's spleen is behaving itself.
The problem with the the splenic tumors, I don't know how many of you guys know that the spleen is basically the blood bank in there. That's where you deposit the red blood cells. You need them. Spleen contracts, puts them out in the tissues. Well, it's just like in the vault of the bank. You have that tumor on the spleen and it ruptures. That means the vault in the bank where all the money's kept, somebody just knocked a hole in the wall.
That's right. And now
So
you got
all that
no
money's
money.
just leaving.
That's right. It left.
Yeah. And you start losing blood like that, you don't have a long time.
No, we do have something, but like even still, okay, so for example, we had an older golden doodle in a couple months ago, and she had this gnarly tumor on her abdomen that was, it really was like, probably like a mammary adenocarcinoma gone wrong. I don't know. It was very unusual, atypical for any like of the quote unquote normal tumors we see.
Right.
And that dog had a spleen rupture. Owner did not want to remove the spleen. She wanted to do palliative care, and so we put her on like clotting meds and iron supplements, and the dog's doing pretty well. I mean, it's been maybe, what did I say, a couple weeks? A month? How long's that been?
It's probably been a month.
Yeah.
Probably close to it.
Time slips from me sometimes, but either way, I have had dogs with ruptured spleens live 6 months on just some clotting factors support.
Mm-hmm.
And so I guess my point with that is some people are like, well, but I wouldn't do surgery anyway. Well, I wouldn't do chemo anyway. Well, just because you wouldn't do chemo, which I totally get, if we're going to be transparent, I don't think I would
Right.
do chemo on my dogs because I just don't feel like I haven't seen enough longevity success with it. I've seen a couple of dogs over the years.
Right. I might on a few.
Depends on the
different
kind of
ti-
cancer.
On
That's-
what it is.
But yeah, no judgment if you don't.
No.
But that doesn't mean we can't do anything. If we know what we're up against, then at least we can explore the options that we have.
Right.
So that would be my take home. If you're in the camp of I'm not going to do anything because I wouldn't go to chemo or because I wouldn't do surgery, that doesn't mean that we don't have options. For sure.
Right. I mean, we very seldom do we not have some option in there.
Yeah.
Now it may not be a great option, and our time frame may not be long.
Mm-hmm.
But
at least you know what you got.
We know what we've got, and say maybe we can. I've had, I think it was last year, a year before, I had one. We had a liver tumor that was leaking and inoperable. Really couldn't take it. It was kind of diffused through the liver. Couldn't take the whole liver. And I want to say it was around the 1st of December or somewhere in there. And they had a child, a son, I think, that was out of state at college, and they're like, "Hey, can we
Need to buy time.
Can we just buy some time to where we can get the son home because that was his dog? He couldn't
Spend
take
some
it to
time
college.
together. Mm-hmm.
He's living in the dorms, just to buy some time." And I'm like, "Yeah, I can probably get you a couple of weeks, but we're at the 1st of December." I said, "I can't get you Christmas."
Yeah.
But I can probably get you a couple of weeks, and he can get home and spend a day or two with his dog.
Yeah.
And
you
whatnot.
never
So,
know. They'll surprise me. I've seen them surprise me on both ends of the spectrum where I really thought we should have had months and we had days, and other times where I thought we were going to have days and we had months.
Right.
They just don't have an expiration date on
No,
them.
they don't.
I've checked all 4 paws.
Yeah. No.
Nothing down there.
No. I mean, we go.
So you just do the best you can.
Yeah, because if we give you recommendations or ideas of what the timeline is, it's our best guess just from what we've seen historically, and there are definitely some outliers.
Mm-hmm.
Yeah, we've had some that come in that you think, oh yeah, we've got 9 months, 12 months, and 2 weeks later they're gone, and
Yeah.
and some you're like, I don't know if we're going to be alive in the morning, and 3 months later they're still going.
Yep. Yeah. It's just so there's no rules. You just got to do the
No.
best you can and work with what you got and hope for the best and all those things. So
Okay.
I think the thing I would like for people to walk away from this podcast with is, what are their sort of what's their walking knowledge on this? In my mind, when I did a brief Facebook Live a few years ago about masses, and I was like, okay, here's where we're worried. If it's bigger than a pea, if it's growing, if it is changing in terms of losing hair, if it's bleeding, or if it's super firm,
Yes.
not soft and squishy. Because almost every dog at some point like even Max, it has multiple lipomas. They're little, they're about pea to half a grape sized. A few of them on his chest, and they're soft, they're squishy, they're freely movable. They don't grow, they don't change, they are not painful, they don't bleed, the hair doesn't fall off. Like all of those things that are worrisome.
Right.
But if you're seeing any of those symptoms,
then we want to assess them initially, because I have had some that felt like it could be something pretty major, and it turns out to be a little lipoma, a little fatty tumor.
Yeah, or
which
like
is great.
the papillomas. The papillomas are small, they're irritating, they bleed, they'll get infected, but they're completely non-pathogenic in terms of causing systemic disease. They're just locally really annoying.
Yes.
So it can go either way,
Right.
but...
Yeah. So with any of them, we want to assess them.
Yeah.
Kind of give our best opinion. Is that something we really need to worry about? Or is it something, no, it's going to be fine?
Mm-hmm.
And if it's something we need to worry about, all right, well, let's look at taking this thing off.
Mm-hmm.
And the sooner, the better.
Yeah, because the less time it has to spread about and do its ugliness.
Right. Well, for two reasons. That, one, for sure. But
You're seeing it from a surgeon's perspective. All of a sudden, I saw where you're going. Yeah.
You remember back, I don't know, what was it, probably 15 minutes ago in this little ordeal, I was talking about the margins.
Yeah.
Of how much tissue you can get. Well, if you have a 30-pound dog, let's say, and I don't want to leave out the cats, but I'm going to use a dog.
You
in
know
this
what
example.
though? But they just don't get the bumps.
They don't get as many.
Not nearly.
They get a few.
And I'm always worried. As soon as I see a cat with a bump,
cat with a bump
I just like immediately
very
like,
worrisome.
where's the panic button? I need to smack it.
Yes. Yeah, cats with lumps it's worrisome.
Yes, it needs to come off.
Yes. But say you have that 30-pound dog, and it's, we'll say a hemangiosarcoma on the skin. And it's the size of a small grape.
Okay.
Well, I need to get 5 millimeters of clean tissue all the way around that.
Okay.
Okay, small grape, that's doable. It's on the chest, there's ribs under there, but I've got, 15 millimeters to get before I get to the chest. Mm-hmm. No problem. Now, you bring me that dog that has a baseball
No mercy.
on that 30-pound dog, I cannot get 5 millimeters of margin at that point.
Yeah. What's the largest tumor you've ever removed? I think I know which one it was, but I'm curious to see.
I've had several large ones. The one that sticks in my mind was a dachshund.
Yeah, the golden retrievers was bigger, but tumor to dog ratio.
Tumor to dog ratio was
That
the dachshund.
dachshund.
It was.
Woo.
Did that end up being a lipoma?
It was.
A lipoma.
No one would touch it.
No.
They came from like Texas because no one
Yeah,
would.
it was huge. I mean, the poor dog, because nobody would work on it at that point. I don't know that I blame them. I don't know how crazy I was for okaying that.
Well, you just got at that point. It was like a rock and a hard place.
Yeah.
Somebody had to do something.
I mean, this dachshund was, and he was a bigger dachshund, probably 30 pounds, maybe not quite that, maybe 27. But he was a bigger, kind of older, larger frame dachshund. This dachshund couldn't walk because the tumor was on his belly. You set him on his belly, and he was teeter-tottering.
Yeah.
He could get his front legs on the ground with the tumor, or his back legs on the ground. Couldn't both. I think that one ended up being 7 pounds.
Yeah, on like
7-pound lipoma on what should have been a 15-pound dog.
Yes.
Yeah, that one was crazy.
That was crazy. The poor dog had to relearn how to walk. He kept falling over because he was so used to compensating for that weight.
Yeah, because it wasn't completely centered. It was a little off to one side. So, he had a couple, 3 weeks there trying to figure out how to walk again.
Yeah.
But did great.
I remember, so I don't do near as much surgery as you, but I remember doing a splenectomy one day on Butters. Do you remember Butters?
Mm-hmm.
And he had this massive spleen tumor. I think we weighed it in at I want to see if you remember the same thing I do.
I don't know. I know it was huge.
I'm going to say 12 pounds. I feel like it was somewhere in
it
that
was
10
up
to
in
12
double
pounds.
digits.
Yeah, 10 to 12 pounds of this tumor on this spleen, this little teeny tiny spleen with this gigantic tumor on it. And I was doing the surgery, and I was like, hey, what's the biggest spleen you've ever taken out? And you were like, that one. Yes. I just stepped in and just took the spot of the biggest spleen removal in Northside history.
Yes.
It was awesome. Anyway, so rewarding because then he felt great. Like he was dying.
Yeah.
And then he felt great.
Yeah.
He did amazing after surgery for a long time.
Yeah, I love those spleen activities if we can get to them
Before the
enough.
dog is gravely ill. Yeah.
Yeah.
You can change their life.
Yes. Yeah.
100%. So, okay, cool.
It's very rewarding.
Yeah, it is. Yeah, and that's the whole thing, right? Is just get ahead of it, prevent regret. Like, I wish I'd have taken this off a year ago. That's
Right.
really kind of the take-home notes for that.
Right.
Let your doctors do the cancer checks, please.
Yeah, and
Especially if you have a golden retriever, please.
please, and we'll have some, and I've had some come in. I'm sure Dr. Keith has too. Come in, feel a little lump that we've seen it there. It's been there. Noticed it a couple of weeks ago. Maybe it started a couple of weeks ago. Maybe it started 6 months ago.
And we just
not
noticed
noticing
it, yeah.
Which is fair.
Mm-hmm.
And we're like, that shouldn't be anything, but watch it. You know, if it starts doing any of the things that we described, you know, starts growing, changing shape, size, color, texture, you know, bring it in. But, you know, we don't think it's anything. Well, 3 weeks later we come in, now it's triple the size. Like, oh, okay, we're wrong.
Yeah.
We got to go do something.
Yeah. Yeah, so really it's about watching it over time. And I've actually seen some masses that we've aspirated at one point, and then like 2 years later, it will start to take on a different cell population because the abnormality in that tissue creates an opportunity for different cell type to take over. And now what wasn't a problem now is a problem. And so, you know, just watching for those changes.
Yeah, because it's a living organism.
Yeah.
I mean,
when in
honestly,
doubt, check it out.
Yes.
Put that on your
For
bumper.
Sure. I don't know how many times I heard that going through vet school.
Yeah, for sure. It's solid advice.
It is.
It stands true throughout time.
It is.
Okay. All right. Well, anything else? Any parting words of wisdom?
I do have one in there that, you know, we talked about chemo, and Dr. Keith and I, you know, may or may not do it depending on the situation. There's a lot of times I will not, depending, you know, knowing what the tumor is, knowing the difference it makes. And if you know, if I'm standing in front of you and we're talking about your pet that has that, I'm going to tell you if I would do it or not. Mm-hmm. I mean, because there's no judge, because there's some of them I will not do.
Yeah. Which, granted, I mean, if they wanted to go somewhere, we would definitely help. Because we only can do certain chemos here.
Right. We can do certain chemos here, not a lot of the big, lengthy kind of drawn out protocols, but we're using several different drugs over weeks at a time.
Yeah.
In there. But one thing I do want to put out is the stigma for chemo, because we see people going through it all the time. And people get sick.
Yeah.
I mean, they get knocked down hard. Doesn't seem to do that near anything. I mean, I've had a few that the day after they're just like, I don't feel great. And then 2 days later, they're back up and doing all their normal stuff. So we don't get the side effects with the chemo that we use that we see in people. And I know a lot of people are worried about that because...
Yeah, they'll say, I don't want to put them through that. And it's like, well, dogs don't really go through that per se. It's more of the whole process that's cumbersome and the time commitment and sometimes the financial commitment.
Right. Yeah, but that's where I've seen once I get to explaining it, most of the hesitation, and which is fair, completely fair. You know, the time commitment, because I know one of the ones that we were doing here that we can do, they're here one day a week for treatment, and they have to come in another day a week for blood work. And I think that's an 8-week course. I'd have to look back in my book because we don't do a lot of them. But it's a pretty big time commitment, and then financial commitment on top of that, because you know, chemo drugs are not cheap. In there, they're not anywhere near what the human drugs versions are.
Right, but
they're not cheap.
Which right now, just like as we're saying that, one of our Facebookers, Love You LJ, is saying get insurance before it's pre-existing.
Yes.
Please.
Yes.
Solid advice.
Get no
insurance
lie.
when your dog is healthy, because ultimately at some point they're going to get sick.
They are.
So
Because I think as a society, we're taking better care of our dogs now than we were 40 years ago. So our dogs are living longer. So you get
and we
through
have
that.
so much more available to them.
Right.
Like, yeah, just costs more to do the fancy stuff we can do now that what we didn't do and all we had was like steroids
Right.
and penicillin.
You know, when your average dog was living to 5 or 6 years, you didn't see a whole lot of tumors, masses in there.
No, they all got hit by cars or eaten by coyotes before
Right.
they got cancer.
You know, but now we're seeing, you know, big giant dogs, 90-pound dogs living to 15, 16 years old.
Mm-hmm.
You know, that's just more time for those cells to go rogue, and we see it more.
Yep.
So we've gotten more available to us. But like I said, it's not cheap. I mean, there's a lot of those protocols that I couldn't do financially myself, and that's even me getting the drugs
Things that cost, yeah.
things that cost, and I couldn't afford to do it. So I understand that. But there's a few that are
At least worth exploring.
worth exploring. They actually have one out now. I don't remember how long it's been out. It's actually something that you give at home. It's a daily pill.
Yeah.
So that takes a lot of the time management stuff out of it.
And the
then-
stress to the pet. Like,
Right. Yeah, they don't have to be at the clinic for, you know, all day one day and then come back to get needles stuck in to get blood drawn. I think there is still a few blood draws on that, but not near as often. So, yeah, just to know that there are some options for chemo that our pets take on. I mean, they handle it. It's way easier on their body than it is on ours. It seems like.
For whatever reason.
Yeah, because a lot of the drugs are the same,
Yeah, I don't know.
and I don't know how
We're
or why.
just sensitive.
Evidently,
Or they're just tough.
maybe that's probably it.
Yeah,
Because
I
they
don't
are
know.
tough.
It probably, if I were actually going to theorize, I would say it probably has to do with I'm just totally guessing. I want to asterisk this conversation. This is my guess. It has to do with their blood-brain barrier because a lot of the symptoms humans have are like nausea related. And
Right.
so like Benadryl, for example, doesn't sedate most dogs like it does humans
Right.
because the blood-brain barrier is so much different. So if I were actually going to guess,
I would figure that plays a
because
big
people
portion of it.
who are undergoing chemo are tough suckers. So I don't want to like take that from them.
No,
So
but I mean, there's definitely some physiological differences that cause that.
yeah, so
so-
don't be afraid to check into it because you might be surprised at how
Right.
well they tolerate it.
Right. And you may say, hey, I want to do everything I can for my patient and you know, for my pet, and well, like it's just like, guys, this one's bad. If we do nothing, the literature says we're going to get 2 months. If we do everything we can, the literature says we're going to get 3 months.
Yeah,
Like,
Yeah.
that's not really worth it.
yeah. I
You
mean,
know,
what
in
are
my
you doing?
opinion.
Yeah, in our opinion. Granted, if you decide to do it, like
You decide to
good
do
on
it,
you.
we're going to hook you up.
Yeah, and then we have another Facebook person asking us what insurance do you recommend. So we don't really affiliate with any one particular insurance, but I get that question. I will tell you a couple of things that are just straight fact. One is that I have pumpkin insurance on my dog. That was the one I chose, like the vegetable pumpkin. And another thing that is a fact is if you go to policyadvisor.com, but it's PAW advisor.com, it's like Travelocity for pet insurance. So you can basically look at a bunch of different options, compare them, see what fits you, what kind of deductibles, premiums, blah, 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 blah,
Right.
blah. Anyway, just a tangent to cover that question. Because I would imagine probably anytime, I think a whole nother podcast will be done on insurance in the near future, but
Yeah, and it probably deserves its own.
it really does. It's upcoming and it's foreign and confusing. And so, yeah.
Yeah, and it will help on a few more that I want to be a part of as well.
Yeah.
Because those TPLO surgeries are not cheap either.
Oh, gosh. No doubt. Yeah, the TPLO is coming
Yeah.
at you at a podcast station called Vet
Yes.
Tales. Are we
Yes.
I don't think station is the right word, but you know what I meant.
Yeah. So to finish up with on the chemo, like we said, there's a lot of it we won't do to our personal animals, and for some different reasons. And depending on the situation you ask, we'll tell you what those reasons are. But even if we don't do chemo, we've got some other options. Like we had mentioned that before. We've got some palliative treatment that we can get by a lot of the side effects that you'll see from some of those tumors, the nausea, the not wanting to eat, the pain and inflammation, things
Yeah.
like that. We've got a lot of options that are a fair number of options. I ain't gonna say a lot, but a fair number of options at our disposal to make them feel better while they're dealing with that.
Yeah, palliative care, as we
Yeah,
say.
just palliative care, and some of that we do in addition to chemo if we want to go that route as well, just to help with some of the side effects of the chemo, because some of the chemo drugs do have some side effects.
Yeah.
Yeah, I mean, as with most drug on the shelf.
Yeah, the goal is always to improve the life quality of the pet to the best of our ability in any given situation. And so it's like you have to ask, what is life quality and what is this situation? And every one of those will be so unique that you really it's just a case by case, but just knowing that you have those options is huge.
Yeah. I mean, there's depending on what we get back as far as a report, we typically not always, a huge majority of the time we have options.
Yeah. Well, there's always options. You just may not like any of them.
Right.
But there's always options, and until you know what you're dealing with, you don't know what they are.
Yeah, you don't know what the options are.
For sure.
Yeah.
Sage advice.
If you probably my final points is if you feel or see a lump or bump, get it checked out, because you'd rather have it checked out and say, yeah, that's nothing, than think it's nothing, and then 6 months down the road, now we're dealing with the basketball on the side of a 20-pound dog.
And just from the internal medicine person in the group, if you have a dog over 7, especially if it's purebred, I think getting an internal check is a good idea, which is just an x-ray and an ultrasound. It's non-invasive, and it's not hard. It's same day. It's like not a big deal. And that could be the difference in good options versus bad options.
Yes, because from the surgeon's perspective on that, it's a whole lot easier to take that baseball-sized mass that the spleen has, remove the spleen with that baseball-sized mass, than it is to remove that spleen with a basketball-sized mass.
Yes. No doubt.
So much easier.
Yeah. So cool. All right. Well, I think we covered a lot of stuff today.
I think so.
Yeah. We appreciate y'all being part of Vet Tales as we try to bring our stories to you for, for you to help your pets. That's really it.
Yeah, just to increase knowledge.
Yeah. I love knowledge. Knowledge is
Yes,
power.
it
Okay.
is.
All right, people. It was nice spending time with you. Bye.